Did you know that fasting can pose a significant danger to people with diabetes? If you are diabetic or know someone who is, this video is essential. Today, we will explore the significant risks of uncontrolled fasting and how it can directly impact blood sugar levels. Stay tuned until the end to discover important strategies for maintaining your health without compromising your condition. Imagine feeling completely in control of your health, understanding exactly how fasting can impact your life. Have you ever wondered why certain dietary strategies may or may not work for you? If you've struggled to keep your glucose level stable, this video is for you. We'll debunk myths and truths about fasting and diabetes, as well as provide practical tips to avoid pitfalls that could harm your health. So, if you're ready to learn more about avoiding the dangers of fasting for diabetics, be prepared to absorb valuable information that will change your approach to nutrition and well-being. Let's begin the journey towards a healthier and informed life together. Diabetes and fasting. To understand the risks of fasting for people with diabetes, it's crucial to comprehend what diabetes is and how this condition affects the body. Diabetes is a chronic disease that occurs when the body either cannot produce enough insulin or cannot use the insulin it produces effectively. Insulin is a crucial hormone that regulates blood glucose, sugar, levels, allowing cells to absorb and use glucose for energy. When insulin doesn't function properly, blood glucose levels can rise, leading to long-term health problems. There are different types of diabetes, with the main ones being type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes is an autoimmune condition where the immune system attacks the pancreas's beta cells responsible for insulin production. As a result, people with type 1 diabetes need to receive insulin through daily injections to regulate their glucose levels. On the other hand, type 2 diabetes is more common and often related to insulin resistance and lifestyle factors, which can be managed with diet, exercise, and sometimes medication. Gestational diabetes occurs during pregnancy and usually disappears after childbirth, but it can increase the risk of developing type 2 diabetes later on. When it comes to fasting, each type of diabetes presents unique considerations. Individuals with type 1 diabetes, who depend on exogenous insulin, are at higher risk of hypoglycemia, low blood sugar, during fasting because they cannot naturally adjust insulin based on food intake. Conversely, individuals with type 2 diabetes may struggle to control glucose levels during fasting due to insulin resistance and decreased pancreatic responsiveness to glucose changes. It's important to note that fasting can affect each person with diabetes differently, depending on factors like age, overall health, current medications, and other existing health issues. Risks of uncontrolled fasting for people with diabetes. Uncontrolled fasting poses significant concerns for people with diabetes due to its potential adverse effects on blood glucose levels and overall health. One of the primary concerns is the risk of hypoglycemia, especially in individuals using insulin or certain diabetes medications. During prolonged fasting, the absence of regular carbohydrate intake can lead to excessive lowering of blood glucose, causing symptoms like dizziness, weakness, intense sweating, and in severe cases, seizures or coma. Insufficient glucose available for cells can severely compromise normal bodily function and requires immediate intervention to prevent serious complications. In addition to hypoglycemia, fasting can also lead to hyperglycemia, high blood sugar, in individuals with type 2 diabetes or other forms of insulin resistance. During fasting, the liver may release glucose into the bloodstream as a natural response to prolonged fasting stress. In individuals with diabetes, who already struggle to maintain glucose levels, this additional glucose release can result in dangerous spikes in blood sugar. Chronic hyperglycemia increases the risk of long-term complications such as nerve damage, cardiovascular problems, and kidney damage. Another potential complication of fasting for people with diabetes is diabetic ketoacidosis, more common in individuals with type 1 diabetes. Diabetic ketoacidosis occurs when the body starts breaking down fats instead of glucose for energy, resulting in the accumulation of acidic ketone bodies in the blood. Prolonged fasting can trigger this process, leading to a serious medical condition that requires immediate treatment in a hospital setting. Therefore, it's crucial for people with diabetes to understand the risks associated with uncontrolled fasting and consult a healthcare professional before considering any fasting practices. Careful monitoring of blood glucose levels and proper adjustment of medication and diet are Myths and truths about fasting and diabetes. There are many myths circulating about fasting and how it affects people with diabetes. Let's clarify some of these common misconceptions. 1. Myth: fasting can cure diabetes. Truth: there is no known cure for diabetes. Diabetes is a chronic condition that requires ongoing care to keep blood glucose levels within the normal range. While intermittent fasting and other forms of dietary restriction may have health benefits, they cannot cure diabetes. 2. Myth: fasting is safe for all people with diabetes. Truth: fasting can be risky for certain individuals with diabetes, especially those who rely on insulin or struggle to control their glucose levels. Consulting a healthcare professional is essential before considering any form of fasting, as each diabetes case is unique. 3. Intermittent fasting is an effective weight loss strategy for people with diabetes. Truth: while intermittent fasting has been promoted as a weight loss strategy, its safety and efficacy for people with diabetes can vary. The focus should be on healthy, balanced eating along with regular physical activity as safer and more sustainable approaches to weight management. 4. Fasting helps regulate blood sugar levels. Truth: for people with diabetes, prolonged fasting can actually lead to dangerous fluctuations in blood glucose levels, increasing the risk of complications. Maintaining a regular and balanced diet, with consistent carbohydrate intake throughout the day, is essential for glucose stability. 5. Fasting can improve insulin sensitivity. Truth: while some research suggests that intermittent fasting may have positive effects on insulin sensitivity in certain groups, such as non-diabetic individuals, results are variable and not always applicable to people with diabetes. Again, it's crucial to assess the risks and benefits of fasting based on individual condition. Debunking these myths helps provide a clearer strategies for safe fasting in people with diabetes. For people with diabetes wishing to explore fasting safely, it's essential to adopt careful strategies and consult a healthcare professional before initiating any dietary restriction practices. Here are some practical tips. 1. Consult your doctor. Before considering fasting, consult your doctor or endocrinologist to discuss your intentions and assess if fasting is safe for you. If you have type 1 diabetes or rely on insulin to control type 2 diabetes, your doctor may recommend adjustments to medication and diet to ensure you can fast safely. 2. Monitor your glucose levels. During fasting, it's crucial to regularly monitor your blood glucose levels. Keep a glucose monitor handy and be alert to signs of hypoglycemia or hyperglycemia. Your target glucose values may need adjusting during fasting to avoid complications. 3. Choose an appropriate fasting pattern. If you decide to fast, opt for a fasting pattern that is safer for people with diabetes. For example, intermittent fasting with shorter and regular feeding windows may be preferable compared to prolonged fasting periods. 4. Stay hydrated. During fasting, ensure you drink plenty of water to avoid dehydration. Dehydration can negatively affect blood glucose levels and increase the risk of complications, especially in people with diabetes. 5. Consider alternatives to fasting. If fasting poses significant health risks, explore other dietary strategies that may be safer and more beneficial. For example, focusing on a balanced diet with controlled portions and proper distribution of carbohydrates throughout the day can help maintain glucose stability. It's essential to remember that overall well-being and health should always be priorities when considering fasting or diet. It's important to emphasize that people with diabetes should always consult a healthcare professional before considering any form of fasting. Safety and well-being should be prioritized, and a personalized management plan can help prevent serious complications. If you found this video informative and helpful, please subscribe to the channel, like, and share this content with others who may benefit from this information. If you enjoyed this video, you will also like the following video that showcases ideal fruits for controlling diabetes.